The federal government has reaffirmed its commitment to reduce Nigeria's high maternal mortality rate by tackling child marriage and strengthening collaboration with the private sector. Minister of Health Mohammed Pate made this known at the 59th Annual Conference of the Society of Gynecology and Obstetrics of Nigeria held in Ibadan, the Oyo State capital.
Nigeria remains among the countries with the highest risk of women giving birth. According to recent estimates, the country recorded around 75,000 maternal deaths in 2023, the highest number worldwide. At the 59th Conference of the Society of Gynecology and Obstetrics of Nigeria, tagged Reproductive Health Benefits, Panacea in Attaining the SDG Goals, stakeholders converged to discuss the long-standing challenges undermining reproductive health in the country, a concern they say must be urgently addressed.
Provides us great platforms and opportunities as SOGOM members and partners and other professional groups involved in women's health to interact, share ideas, network, and push the agenda for the highest levels of health care for women through their journey from childhood to reproductive years and even beyond.
The Minister of Health, represented by a special advisor on health system strengthening, noted that although the federal government has already introduced measures to confront the problem, it will continue to adopt more pragmatic approaches to further reduce the burden of reproductive health complications across Nigeria.
Currently, we know that about 70% of contraceptive needs are obtained in the private sector. And it is therefore important that the private sector must continue to be engaged if indeed we want to make any difference in our reproductive health parameters. Additionally, we must do everything within our capacity to eliminate child marriage. That impacts about 45% of Nigerian girls, robbing them of their youth and jeopardizing their health.
So that's one thing, increasing the expenses on health, and then we also spoke about global partnerships. What is known is that this SDGs is not just for a nation to achieve or one ministry. You need to have effective interactions between, different sectors of the economy, between different nations.
Experts here believe that only a well-funded, accessible and equitable health system can guarantee improved reproductive health outcomes and position Nigeria on track to meet global development targets. Oladio Yewole, TVC News, Ibadan.